I'm Cliff Reid. I'm an emergency physician. I'm the Director of Training for the Greater Sydney Area Helicopter Emergency Medical Service in New South Wales in Australia. My talk is about the cutting edge, and the title of the talk is What It Takes to Be at the Cutting Edge. And really, when we think about being at the cutting edge, we've got to define it, haven't we? And if you look at Wikipedia, it talks about offering the state of the art in a particular field. So if you want to be cutting edge, you've got to think in emergency medicine about whether it's a cutting edge service you want to provide or whether you want to be a cutting edge individual. So I've looked at what it takes to be a cutting edge individual, what differentiates those people from your average person, and also what cutting edge organizations seem to deliver in terms of their philosophy, their ways of doing things. I think in emergency medicine it's so broad because we do so many different things, it's hard to be cutting edge at the whole range of the clinical spectrum that we're forced to deal with. So I focus particularly on the cutting edge in resuscitation. If we look at individuals, what makes them become experts or masters at something, it's really about how they learn. If you take a chess master or even someone who's expert winning competitions in Scrabble, professional musician or basketball player, the way they learn the subject isn't just by playing more games and accruing experience. What they do is something called deliberate practice or effortful practice, where they will break down the components of their skill and they'll create specific exercises with the explicit goal of achieving excellence in that one part of the skill, which they'll then put together. So chess masters will read around the topic. They'll read chess books, they'll study previous games and the moves in previous games. Scrabble players, they won't just play lots of games of Scrabble, they will study how to make anagrams, they'll revise word lists from dictionaries and so on. And we can do that in emergency medicine. We can take a skill and break it down and really study the intricate components of it. So I think a cutting edge emergency physician, when they look at something like airway management, they didn't just turn up to their anesthetic rotation and do lots of tubes and then go back to emergency medicine thinking they would be expert at that. Some unfortunately do, and all they become is rusty novices. What the experts do is they do deliberate practice, effortful learning. They will work out different ways of holding a laryngoscope. They'll practice different bougie grips, ways of moulding a stylet. They'll be on the part task trainer, they'll embrace the opportunity to do simulations, they'll do a cadaver course, they'll elbow their way to the head end of the resus room to do as many airways as they can. And someone with that learning attitude, after a few years, will become an expert at emergency airways, far more than, say, the anaesthetic registrar who's just turned up with a learn as you go on mindset through experience. Cutting edge organizations, I think, have something in common with those cutting edge individuals in that they have a way of learning. The organization can learn. It has an attitude of openness and wanting to improve based on feedback. There's a bunch of other things we go into as well in terms of good leadership, standard operating procedures, good audit, which requires good data. And these, of course, all make up the pillars of good clinical governance. But I think underpinning good clinical governance is an attitude towards learning and sharing that learning amongst the team. So what can people who watch this do to make their service cutting edge or to make themselves or their trainees cutting edge? Maybe there's a few take-home messages. I think the first thing is have a shared attitude of learning within your department. Share your cases and ask yourselves as leaders or consultants what you could have done better and share those learning points so everyone's seeing you're wanting to improve and people continue to rise along that trajectory and get better at what they do. For a teaching session, don't say, today we're going to do bag mask ventilation and then just recycle a workshop for an advanced life support course. Really get into it. Grab that bag and mask, take it apart, put it back together under a time limit. Work out different ways of holding it, compare different grips, do it on each other's faces because you've all got different shaped faces. Can you all get a good seal on every shape of face? What if someone has a beard? What if someone is obese? What if someone is completely flat in a trauma situation rather than being able to sit up? When would you use a PEEP valve? What if someone's got trismus and you can't open their jaw? How do you apply a bag valve mask there? What if you have to bag mask someone through a tracheostomy wound? How do you break down and have effortful, meaningful learning with deliberate practice to really own the skills? That's how I think you can become a cutting-edge individual. And if you take that approach to teaching within your department and share your learning points, you have an opportunity to become a cutting-edge department.